What is the most common reason for an ECMO circuit to fail? A. Inadequate anticoagulation therapy. B. Hemolysis, red blood cell destruction. C. Failure of the pump motor. D. Displacement of the cannula. Answer: B. Hemolysis, red blood cell destruction. Explanation: hemolysis is one of the most common issues with ECMO circuits. The blood passing through the circuit can be damaged by high shear forces, especially in the pump, leading to the destruction of red blood cells. Hemolysis can result in complications such as anemia, kidney injury, and other organ dysfunction. What is the most critical factor to monitor in a patient on ECMO to prevent thromboembolic events? A. Blood glucose levels. B. Hemoglobin levels. C. Activated clotting time, ACT. D. Respiratory rate. Answer: C. Activated clotting time, ACT. Explanation: the most critical factor to monitor in ECMO patients to prevent thromboembolic events is the activated clotting time, ACT. ACT reflects the effectiveness of anticoagulation therapy, and it helps in preventing clot formation in the ECMO circuit, which could lead to thromboembolic events or damage to the circuit. What is a common reason for initiating ECMO in a patient with acute myocardial infarction, MI? A. To replace the heart's pumping function in cases of cardiogenic shock. B. To decrease the workload on the heart. C. To support the lungs during mechanical ventilation. D. To prevent arrhythmias during recovery. Answer: A. To replace the heart's pumping function in cases of cardiogenic shock. Explanation: ECMO is often initiated in patients with acute myocardial infarction, MI, complicated by cardiogenic shock when the heart is unable to maintain sufficient circulation. Veno-arterial, VA, ECMO provides both cardiac and respiratory support by taking over the function of the heart and, in some cases, the lungs. What is the primary purpose of de-airing the ECMO circuit before initiating therapy? A. To prevent blood clotting. B. To avoid air embolism. C. To ensure adequate blood oxygenation. D. To increase blood flow rates. Answer: B. To avoid air embolism. Explanation: de-airing the ECMO circuit is crucial to remove any air bubbles before starting therapy. Air embolism can occur if air is introduced into the bloodstream, leading to obstruction of blood flow, potentially causing life-threatening complications, including stroke and organ damage. What is the typical duration for weaning a patient off ECMO? A. 24 to 48 hours. B. 1 to 2 weeks. C. 3 to 7 days. D. Variable, depending on the patient's recovery and condition. Answer: D. Variable, depending on the patient's recovery and condition. Explanation: the duration of ECMO weaning is highly variable and depends on the patient's recovery, underlying condition, and response to the reduction of support. Some patients may require days, while others may need weeks to fully recover and be safely weaned off ECMO support. Which of the following patients would not typically be a candidate for ECMO therapy? A. A patient with severe ARDS due to viral pneumonia. B. A patient with irreversible brain damage and organ failure. C. A patient with acute cardiogenic shock due to a heart attack. D. A patient with acute respiratory failure due to trauma. Answer: B. A patient with irreversible brain damage and organ failure. Explanation: ECMO is generally used to provide support for patients with reversible conditions such as acute respiratory or cardiac failure. It is not appropriate for patients with irreversible brain damage or multi-organ failure, as the chances of recovery are minimal, and ECMO would not improve outcomes in such cases. What is a major difference between venovenous, VV, ECMO and veno-arterial, VA, ECMO? A. VV ECMO requires more anticoagulation than VA ECMO. B. VV ECMO is used when both the heart and lungs need support, while VA ECMO is used only for lung failure. C. VV ECMO does not provide any circulatory support, while VA ECMO supports both heart and lung function. D. VA ECMO is used for respiratory failure alone, while VV ECMO is used for cardiac failure. Answer: C. VV-ECMO does not provide any circulatory support, while VA-ECMO supports both heart and lung function. Explanation: the primary difference between VV-ECMO and VA-ECMO is that VV-ECMO provides respiratory support alone, while VA-ECMO supports both cardiac and respiratory functions. VV-ECMO is used for respiratory failure when the heart is still functioning, whereas VA-ECMO is used for cases of severe cardiac failure, e.g., cardiogenic shock, that also require lung support. Which of the following is a primary concern when using ECMO in pediatric patients? A. Risk of gastrointestinal bleeding. B. Cannula size and vascular access. C. Difficulty in monitoring hemodynamic parameters. D. Increased oxygen requirements. Answer: B. Cannula size and vascular access. Explanation: in pediatric patients, the main concern when initiating ECMO is selecting appropriate cannula size and ensuring proper vascular access, as children have smaller blood vessels than adults. Incorrect cannula placement or size could lead to insufficient blood flow, clotting, or injury to the blood vessels. During ECMO therapy, what is the role of the membrane oxygenator? A. To assist in clotting prevention. B. To deliver mechanical ventilation. C. To carry out the gas exchange, oxygenation and CO2 removal. D. To filter waste products from the blood. Answer: C. To carry out the gas exchange, oxygenation and CO2 removal. Explanation: the membrane oxygenator is responsible for gas exchange in the ECMO circuit. It allows for oxygenation of blood and removal of carbon dioxide, mimicking the function of the lungs. It is the central component in ensuring that blood returning to the body is properly oxygenated. How does ECMO support a patient's lungs in the case of acute respiratory distress syndrome, ARDS? A. By increasing airway pressure. B. By replacing the function of the alveoli and facilitating gas exchange outside the body. C. By preventing ventilator-induced lung injury. D. By increasing oxygen delivery to the tissues. Answer: B. By replacing the function of the alveoli and facilitating gas exchange outside the body. Explanation: in cases of ARDS, the lungs are unable to provide adequate oxygenation. ECMO supports the patient by taking over the role of the alveoli, allowing for gas exchange, oxygenation and CO2 removal, outside the body in the oxygenator. This gives the lungs time to recover while oxygenating the body.